A model of a breathing exercise, the Triflo studies, is an exercise device that we utilize to open our lungs to their full capacity following surgery in order to enable them to function at their full capacity once again. It is specifically designed for the patient to take deep breaths after anesthesia while being connected to the machine in order to reopen the lungs that have been closed due to the surgical procedure and facilitate their return to normal functioning. Inhaling deeply and exhaling into bowls simultaneously aids in expanding our lungs and improving respiratory function. It is of utmost importance to take necessary measures to prevent lung infections that may happen subsequent to the post-operative period. The objective is to restore both the complete capacity functioning of our lungs and to guarantee the desired amount of blood circulation in the body, enhance organ blood flow, and augment the rate of healing. We want our patients to start drinking water after surgeries. However, the issue is that while drinking water, there may be an increase in the feeling of nausea due to the effect of anesthetic drugs on the patient. We always provide advice to our patients to sip water slowly, but if they feel nausea persisting or increasing despite this, we also give them instructions to take a break from drinking water. But if there is no such issue, we inform them that they can finish a small bottle of water, 200-300 ml, by sipping it slowly in 2 hours. This way, we are now transitioning to post-operative nutrition. Swallowing water may be a bit difficult. The patient may naturally experience difficulty swallowing water. There may be a feeling of obstruction or difficulty while swallowing and a slight pain sensation after swallowing. These are expected things. There is no need for our patient to worry when they experience these. It will return to normal completely after a few days. One of the aspects we must focus on following surgery is for your patient to recover their health expeditiously, enabling them to resume their daily activities and for the prevailing pain and nausea to alleviate. The primary objective we have for them is to engage in walking. We desire for our patient to commence moving and walking 2 hours after the surgical procedure. There exist numerous advantages to this approach. The objective is to ensure the rapid restart of blood circulation in the patient, which is crucial for preventing blood clots, a potential problem that can have serious consequences if not addressed promptly. The development of blood clots that travel towards the lungs, leading to a condition known as pulmonary embolism, where a clot in the lung vessels severely impedes the patient's ability to breathe, is arguably one of the most feared scenarios for us following surgical procedures. To avoid this, we consistently initiate walks for our patients within the initial 2 hours following surgery. Getting up and starting to walk right away on the initial walk can lead to feelings of dizziness. Therefore, after the surgery, the patient will experience improvement by waiting for a period of 3 to 5 minutes with their feet hanging down over the edge of the bed before taking their initial walk or any subsequent walk, and then we advise them to stand up and commence walking. I would like the patient to perform this activity every hour at a minimum of 2 hours after the surgery for a duration of 10-15 minutes, either by walking inside the room or taking walks through the long corridors. As previously stated, this will be advantageous for our patient in numerous ways. Due to its facilitative and strengthening effects on blood circulation, which we strongly recommend for our patients to wear before surgery, and its ability to reduce the risk of embolism and blood clot formation, we advise this to all our patients. We always ensure to put them on prior to the surgery. Once the socks are on the patient, we advise against removing them for 2 to 3 days throughout their hospital stay. If our patients are going on a long journey, we recommend that they wear compression socks on their feet during this travel after the surgery. It is an important factor in order to prevent the issues that our patient may encounter following the surgical procedure. The incisions we make are quite small, 0.5 centimeter and 1 centimeter incisions, and we believe these are clean wounds. After the surgery, starting from the next day, we usually do not feel the need for a new dressing after wound care. Starting from the day after the surgery, the patient can take a shower, bathe, repeat this daily, and we actually consider this bath as a kind of dressing for the patient. Keeping the wound clean is of utmost importance. If the patient is feeling well and able, they have the option to shower and leave the wounds uncovered without any dressing or bandages, starting from the day following the surgery. There is no necessity to cover the wounds with dressing. The process of wound healing usually takes approximately 4 to 5 months. Throughout this period, we highly recommend the application of creams to prevent any color changes in wounds and to ensure that the wounds heal with minimal scarring, leaving no large marks, by actively promoting the healing process that effectively reduces the formation of scars and promotes anti-scar healing. We believe that St. John's wort oil is truly very beneficial. Additionally, there are anti-scar creams available in pharmacies. We recommend these. In addition, we strongly recommend applying high-factor sunscreens with SPF 100 or higher regularly to scars for 6 months. One of the greatest advantages of small incisions is that the patient can quickly return to their daily life after surgery. Due to the small size of the incisions and the internal stitching of larger incisions, we firmly believe there will be no opening or herniation. Within a month, we expect a significant weight loss of over 25 kilograms, which is a remarkable outcome. They should not lift heavy objects, but after the initial month, we no longer have such restrictions. We provide guidance regarding weightlifting after the surgical procedure. After obesity surgery, it is also our desire for the patient to return to social life and work life quickly, to be active. It increases the patient's motivation, helps burn calories through daily activities, and contributes to the patient feeling better psychologically, socially, and mentally. I expressed that one can return to work life after a rest of 3 to 4 days, and in fact, returning would be very beneficial for oneself.
Hello, I am dietitian Elif Aluç. Today, I will introduce the medications you need to use after surgery. First, let's start with our stomach protector. Pant Active Stomach Protector Tablets. You should use one of these every day for 6 months after the surgery. You can take it on an empty stomach about 30 minutes before breakfast. And these are small tablets. There is no problem with swallowing them. There are also 2 in the boxes we have given you. By getting 4 more, you can complete a total of 6 months. Pantoprazole, Tri-PPI, proton pump inhibitor, protective medications like omeprazole and lansoprazole. There is another medication you need to use for a period of 6 months after the surgery. This is our multivitamin syrup. You can use this syrup twice a day, taking 2 spoonfuls with the spoon provided. However, after finishing this syrup, you should switch to tablet, effervescent, or chewable tablet form. After the surgery, you should use blood thinner injections for 10 days to reduce the risk of clotting. These injections are single-use injections that you can administer yourself. You can apply these to the arm, abdomen, or leg. It should be done once a day and at 24-hour intervals. You should use antibiotic tablets to prevent your wound sites from getting infected. You should take these antibiotic tablets twice a day, in the morning and evening, for 5 days, with food. You can start using the medications we have described the day after you are discharged. Your medications will be delivered to you along with your protein powders by your translators. Today we will discuss our nutrition plans together. First of all, we initiate with water intake 8 hours after the surgery. Here we will attempt to consume a 200 milliliter water bottle gradually, sip by sip, during a time span of 2 hours. Nausea may occur 1 to 2 days after surgery. These complaints are very normal. Let's try to drink as much water as you can slowly without pushing yourself too hard. This is one of the most important steps for the recovery process after the surgery. Starting from 2 days after the surgery, we begin our liquid diet. And in the upcoming 2 weeks, we will continue to make progress with clear, seedless, sugar-free liquids. During this liquid diet process, the key beverages for us are, of course, protein powders. Because after surgery, we need approximately 60 grams of protein, which is very difficult to meet with regular fluids. Therefore, we recommend consuming protein powders 3 times a day, starting from the day we begin the liquid diet. Here, when making protein powders, we require 200 milliliters of liquid. Protein powders can be a bit sweet and heavy on the stomach. Hence, we'll use 100 ml of lactose-free milk or 100 ml of water, or add 200 ml of water, pour one of our protein powder sachets, shake it, and consume it that way. Once again, as we have a 200 milliliter liquid, you can sip it slowly over a duration of 2 hours. If it feels heavy, you can attempt walking while consuming. This also sometimes aids with improved digestion. Our primary suggestion for us is our protein powders. During these 2 weeks, we also have other choices we can consume occasionally, primarily dairy products. Lactose-free milk is possible, kefir is possible, Actimel is possible. Apart from these, we can also drink ayran. The reason we recommend lactose-free is that lactose can be a bit heavy, especially after surgery. It can lead to gas problems. Hence, particularly in the upcoming 1-2 month span, it's better to use lactose-free, especially for milk. We also prefer sugar-free kefir at all times, so you can generally choose plain kefir. Similarly, you can opt for sugar-free plain Actimel as well. When preparing ayran, you have the option to combine water with a small amount of yogurt and then include salt. Alternatively, you can also buy packaged ayran if it is available for sale. It is always better to prepare at home. Other options we can drink include meat, bone, chicken broths. When preparing these, we boil the chicken or meat. To enhance flavor, you can add other veggies for aroma. For instance, carrots, zucchini, celery, etc. Add salt if not excessive. In addition, you can use mild spices like thyme, mint, cumin, which do not cause pain, in a very light manner that will not strain the stomach too much. But you shouldn't put onions, garlic, spicy spices, tomato paste, lemon in it, because our stomach is a bit sensitive during this process. Utilizing these can result in an augmentation in stomach acid levels and feelings of discomfort. Therefore, we boil and strain all the mentioned foods and then only consume the resulting liquid as drinking water. There should not be any seeds present in it. You should not blend it together. We will only consume the clear broth that is made from either meat or chicken. We do not consume fruit juice, but you have the option to consume compotes. When preparing compotes, we boil the fruits for approximately 20 to 25 minutes. We shouldn't add sugar to it, but you can sweeten it by adding cinnamon or cloves. Here you can use most fruits. Only sour fruits are a little problematic for us, like cherries, oranges, because they can also raise the acidity level of the stomach similarly. As an illustration, we boil fruits like apples, pears, apricots, dried plums, and strawberries, strain them and solely consume the extracted juice. If you don't like the taste of regular milk or don't usually consume it, you can also use oat milk, almond milk, coconut milk, and soy milk. You can prepare your protein powders with these as well. But there are 2 things to note here. First, some plant-based milks may have added sugar. However, we should choose those without sugar. So, we must read the ingredients carefully. The protein content of oat milk and almond milk is extremely low. As a result, you might prefer to use soy milk instead. The protein content of soy milk and of course lactose-free milk can help you reach this 60-gram amount. There are some protein-rich milks available in stores. These actually resemble the protein shapes we create, but these are some milks that are sold pre-made. You can also use these as an alternative if you want, but our priority is always our own protein powders. You should also make sure that these are lactose-free and sugar-free. Finally, during the liquid diet process, you can benefit from herbal teas, such as fennel, chamomile, mint tea, linden. We can drink herbal teas like such. However, there are some beverages that we should not consume. First, coffee. Due to its high caffeine content, it may not be gentle on the stomach. It may also cause discomfort. We will avoid coffee for 2 months. However, you can start drinking decaf coffee without a cage after another 2 weeks. I do not recommend drinking black tea and green tea during this 2-week period. If you really want to, you can have a very light black tea. But other than that, we should try to stay away as much as possible. During this 2-week period, we need to be careful that the beverages we drink are not too hot or too cold. Prefer room temperature as much as possible. It can be slightly cool or warm, just avoid extremes. Our 2-week liquid diet process. We consume our protein powders thrice daily. In the intervals, you can gradually sip on the mentioned drinks throughout the day. Here we do not have any meal times or meal counts because everything is already in liquid form. Throughout the day, we'll sip liquids intermittently as much as your stomach can handle. And of course, we won't skip milk consumption here. After our 2-week liquid diet process, we move on to our Puree Diet phase, our soft diet. Also takes 2 weeks in the same way. The important thing here is that everything we eat should be as soft as we can crush with a fork. Just like in the liquid diet, here we'll keep eating frequently but in smaller portions. However, now our meal numbers and concepts are getting clearer. We need to have 3 main meals a day, breakfast, lunch, dinner, and also 3 snacks. So we will have a total of 6 meals a day. This means we should have a meal every 2.5 hours. Once you start the diet, you will notice that you will start feeling full even with very small amounts, which is why we may feel hungry more often. To avoid slowing metabolism, we must pay attention to having 6 meals daily for enough protein and energy in order to maintain a healthy metabolic rate. If you try to get by with just 1 or 2 meals a day because you're not hungry, then naturally we won't be able to get enough protein and energy. This will also make it challenging for you to lose weight. We ensure not to skip meals and always consume foods that are high in protein. You can start with eggs and cheese with our breakfast options, because they are quality foods in terms of protein. We can boil and mash the egg. Or we can cook it gently in a pan like scrambled eggs. You can eat it by chewing thoroughly. Alternatively, we can make it as poached eggs by boiling in water. This way it becomes a soft liquid. We will typically favor soft cheeses. These can include cream cheeses, strained cheeses, light white cheeses, cottage cheese, curd cheese, and similar varieties of cheeses. But for example, we will not use cottage or Kassar cheese because these are hard cheeses, also high in fat cheeses. You can incorporate foods that are rich in protein, like meat, fish, chicken, and turkey, into your lunch or dinner meals. Here, the key is to consume minced meat as red meat, because whole pieces of meat may feel a bit tougher on your system currently. You can take some lean minced meat, cook it slightly in a non-stick pan, and consume it with vegetables, or mix it with yogurt if you prefer. Chicken, however, may remain a bit tougher. Therefore, it is beneficial to use chicken thighs. They are rich in iron and softer compared to the breast part. You can boil it and shred it a bit with your hands, or you can cook it all together with vegetables as if making chicken broth. Instead of straining them, you can blend them all and drink it like soup. It can be a different alternative for you. You can also eat fish. Fish is already very tender, no need to do anything extra. I recommend cooking without fat. You can use baking or boiling here. Also, remove the skins as they can make digestion a bit harder. After mashing with a fork, consume by chewing thoroughly. While on a puree diet, we continue with our protein powders. Unlike the liquid diet, we will only consume it once a day. Similarly, you can mix 1 packet of protein powder with 200 milliliters of water or milk, lactose-free milk. It's included in our diet plans as lunch. But it's important to consume a protein daily, so we can make changes in our diet. You don't have to necessarily mix it with water or milk. If desired, make it into a smoothie. Blend kefir with strawberries and add strawberry protein powder, or mix it with yogurt. Blend fruits with yogurt. You can also include your protein powder in that manner. In the meantime, we can proceed to consume our lactose-free milk, kefir, and ayran beverages. In addition to that, we can commence consuming yogurt and also commence consuming fruit purees. In this case, we will utilize plain regular yogurt. Alternatively, you can also utilize high-protein yogurts, high-protein sugar-free puddings as snacks. It is more beneficial for us to blend the fruits in the blender for optimal nutrition and enhanced taste experience. Due to the fact that raw fruits can be somewhat challenging for you to consume before starting your diet, you have the option to incorporate fruits such as apple, pear, peach, apricot, and banana. The only fruits we should avoid are sour fruits. It would be better for you to stay away from fruits like tangerines, grapefruits, cherries, kiwis for the next 3 months, because these can also be high in acidity, causing complaints such as heartburn. You can also consume vegetables with your dinner. When we cook vegetables in the same way, they become very soft. You can slightly mash them with your fork and consume them that way. Here, you have the option to utilize spinach, zucchini, eggplant, roasted peppers, mushrooms, and various other vegetables. Roast eggplant and peppers. Peel off skins, mash slightly with a fork. Sauté spinach in a pan, maybe mix with minced meat or chicken. Enjoy a flavorful dish. You can chop the mushrooms into small pieces, mix them with vegetables and yogurt, and consume them in that way. We don't need to blend everything. There are also foods we should avoid during this process. Stay away from these for about 2 to 3 months. First of all, as I mentioned before, we will avoid sour fruits such as oranges and tangerines for a period of 3 months. I said you can eat veggies, but we don't want you consuming raw veggies during this process. For instance, cucumbers, tomatoes, and greens are hard to digest as they are vegetables. During this process, it may bother you a bit, cause pain, and be difficult to digest. I recommend staying away from carbohydrates during the 3-month period. The most important nutrients for us are proteins, and now our stomach also has a capacity. Therefore, in the first 3-month period, our priority is always to eat protein sources. When we introduce a carbohydrate source, naturally you cannot get enough protein, because our portions are quite limited. During this 3-month period, I do not recommend consuming bread, rice, pasta, sweets, or sugar. Similarly, when we say puree, mashed potatoes may come to mind. But this is still closer to carbohydrates for us due to its high starch content. Therefore, I do not recommend adding vegetables with high carbohydrate content such as potatoes, sweet potatoes, corn to your diet within 3 months. This will not only assist us in obtaining sufficient protein, but also aid us in successfully navigating our weight loss procedures. During the period of 2 or 3 months, you should also refrain from adding foods such as onions, garlic, tomato paste, lemon, and spicy spices to your meals. These can also slightly enhance the acidity of your stomach and cause discomfort. In the meantime, we can prepare smoothies and fruit yogurts for ourselves. Avoid buying ready-made ones here from supermarkets. They tend to contain added sugar. But you can prepare smoothies for yourself at home, for example, by making yogurt with strawberries in a blender or by blending bananas and strawberries with kefir. As mentioned in the Puree Diet, you also need to consume 1 protein powder daily. You can add it to your smoothies and yogurts too. Or you can mix it directly with water or lactose-free milk. We have a rule that we will start in the Puree Diet phase and continue throughout our lives. This is solid and liquid separation. In short, we don't eat and drink simultaneously. We have 30-minute gaps between foods and liquids. For instance, you wake up in the morning and drink water. Then we need to wait for half an hour for you to have breakfast. You've had your breakfast, you ate an egg or you had some cheese. Then you want to have another tea. We need to wait for half an hour and then drink our tea. Eating and drinking simultaneously may initially cause discomfort, including pain, nausea, and vomiting. When you eat, we want food to stay in your stomach for long, so you feel full throughout the process. But when we drink after eating, the liquid pressure can help food move towards the intestines faster. Therefore, you may experience digestion problems. You may feel hungry sooner. You may also lack vitamins, minerals, and nutrients. That's why this rule will always be valid in our lives. You should also heed this throughout your lifetime. One of the most frequently asked questions when we start a puree diet is about soups. On a liquid diet, we only drank meat and chicken broths, but now we can start drinking more soup here. However, in this case, we need to pay attention to soups that do not contain ingredients such as cream, noodles, or rice. We already needed to refrain from these to support our weight loss. Lentil soup, tarhana soup. Perhaps we can commence consuming them a little bit more. As mentioned, in the first 3 months, tomato paste, tomatoes, they can sometimes upset the stomach a bit. Based on your tolerance, it's beneficial to continue by contacting those you've grown with here. Our 2-week holiday is passing like this. In the mornings, we usually eat eggs and cheese. We can have our protein powders at lunch. In the evening, we will again eat foods rich in protein such as meat, chicken, fish, and turkey. As I mentioned in the middle, we also have a total of 3 small snacks. Here we can continue with various food items such as dairy products, yogurt, and different fruit purees. As I mentioned at the beginning, it is beneficial to have a meal every 2.53 hours to not slow down our metabolism and to support weight loss. During this process, you may not even feel hungry. You may not have an appetite, but by saying "I'm not hungry," you should not skip meals a day. Even if you don't feel hungry, put your food in front of you. Eat as much as you can with the number of spoonfuls it takes for you to feel full, and stop when you feel satisfied. What matters here is not so much the quantity, but how well we are nourished, how rich we are in protein. We will always chew our food thoroughly while eating. You may commence utilizing small spoons and small plates at the outset of your meal. By chewing thoroughly, eating slowly, focusing on our meal, and stopping when we feel full, we will finish our meal. After discharge, our goal is to drink 2 liters of water daily. At first, this can be tough, but my advice is to get a bottle that you can easily carry with you after discharge. Especially aids in monitoring your water intake. It also serves as an extra source of motivation. By adding fruit slices like lemon, cinnamon, and cucumber, we can enhance the flavor of the water, making it more enjoyable and full of taste. This also aids us in reaching a volume of 2 liters. You can also give this a try. After discharge, our goal is to take 10,000 steps per day. You can perform daily walks for approximately 45 minutes to 1 hour. It aids in improving your well-being. Supporting us in avoiding muscle loss while losing weight will help us experience fat loss as much as possible. Of course, exercising is also important here. However, we do not recommend intense sports activities during the first 2 months. It is better to continue with walking or swimming, but after 2 months, you can start doing any kind of sports. You can also begin lifting heavy weights. You can engage in weight training or commence participating in any sport you enjoy on a regular basis. This will help us not only in losing fat, but also in preventing muscle loss. Loose skin may occur due to fast weight loss. Similarly, exercise is also crucial in this context. When you exercise as much as possible and do it regularly, these sags will be minimized. Of course, water intake is also very important for the elasticity of the skin. So, water and exercise are as important as nutrition. Therefore, they are situations that should never be overlooked. After 2 weeks of liquid and 2 weeks of Puree Diet, we start solid food after 4 weeks, which is at the end of 1 month. Here, in fact, our diet is like a puree diet, because essentially, we'll nourish ourselves with protein-rich foods and maintain small, frequent meals. But here, we will now continue our diet by chewing our food thoroughly and eating with a fork and knife, without the need to mash or blend our food. Here, what's important again is to definitely have our 3 main meals and 3 snacks every day. We never skip these. And always make sure to include a protein source in every meal. This could be eggs, yogurt, milk, chicken, fish, or meat. This way, we'll keep going with our first month. We'll have more duration options in the diet. You'll see this in the diet plans we'll resend you. For instance, you can begin consuming oatmeal porridge for your morning meal at this location. You can combine approximately 1 to 2 tablespoons of oats with a small amount of milk or yogurt. We have the option to include cinnamon as well as fruits such as banana, apple, or berries. If you have extra protein powder, you can add it. Cook oatmeal with protein powder. More alternatives are increasing during this process. However, still do not prefer oatmeal porridge more than 2-3 times a week, because it is not a food source that provides as much protein as an egg or cheese. These are much more beneficial for us. We can start eating olives. We can start eating smoked turkey. If you like, we can also add these to the diet. We're not using protein powders at the end of 1 month. You don't need to use them anymore. Our dinner and lunch meals will be very similar. Here we will continue to eat meat, chicken, and fish. But besides ground meat, here you can start eating some chunky pieces of meat or small diced meats, or consume them in the form of meatballs. We don't necessarily have to boil and shred the chicken anymore. You can cook it in a pan with olive oil and mild spices like a chicken sauté. You can cook it with vegetables. Fish, on the other hand, we continue in the same way. We do not use frying methods here. As I mentioned, you can continue to use boiling, grilling, baking, and air fryer. You can now also add foods like chickpeas, beans, lentils to your diet. These will also support us as plant-based proteins. We don't recommend the use of onions, garlic, and tomato paste for 3 months. You can boil and mix them with vegetables and eat. Starting from the first month, we can begin to use the leafy parts of greens. For example, you can start consuming lettuce, arugula, and parsley leaves by chewing them thoroughly here. You can perhaps consume them combined like a salad. We will keep preparing our appetizers in the identical manner. We can keep consuming lactose milk, kefir, and ayran. We can also keep having yogurt. You can now start eating fruits by chewing them thoroughly instead of in puree form. We can also start eating raw dried nuts. In terms of healthy fats, they will also support us in losing weight. We can now include approximately a closed handful of nuts such as walnuts, almonds, and hazelnuts in our snack. Additionally, there are some blood tests that need to be done after the surgery. You can observe these in the diet plans we have given to you. These tests are conducted initially after 1 month and subsequently after 3, 6, 9, and 12 months. You can have it done in months and submit it to us face-to-face, or you can submit it online. After discharge, follow-up appointments, diet plan adjustments every 3 months, and blood test reviews will continue when you return home. And this time, we will also send your new diet plans to you online. That's all I have to share for now. If you have any questions or encounter any problems during this process, do not hesitate to contact us. Feel free to reach out to us. Wishing you all healthy days.